Hello everyone, and here is the screencast for using Health Literacy Questionnaire. This one is important because there's a number of places and repositories that list health literacy questionnaires on a variety of topics. This one kind of sets that stage. So without further ado, here we go. So again, we have a definition, or we look at what health literacy is. Okay, what are some of the earlier interventions? And I like what we have the World Health Organization. And before I move on, let's get the tools going. Health literacy has been defined as the cognitive social skills which determine the motivation. Remember, motivation was in the other article, right? And the ability of individuals to gain access to understand and use information in a way for good health. Dr. Google talked about that. As we go through, start collecting that definition. Notice similarities and maybe the differences. Okay? By adding equity concerns, America's low literacy level is significantly associated with race, socioeconomic status, and the level of education. Okay? I'm going to scroll down here. And one of the things I think was very quite poignant with regards to this article is this quote by Kelly and Haydet. Okay, it's the lack of knowledge among providers regarding issues related to health literacy can substantially alter a patient-provider communication and hinder benefits of expected care. So, just because somebody has an MD doesn't necessarily mean that they have a high health literacy. Do they have a health literacy? Yes. Is it higher than their patients? More than likely. I'm making that inference. I don't have any data to back that one up. But not having that communication and knowing what the level of literacy is of their patient can hinder the expected health outcome. Okay. Additionally, I want you to kind of be aware of this. The Health Literacy Questionnaire scale reflects skills related to EI clinical practice as outlined in the DEC's recommended practice for early childhood. If you get a chance, one of the main advocacy efforts for health literacy is presented by the CEC, the Council for Exceptional Children. They are an amazing organization to be a part of, and the early childhood initiatives are vital to getting that health literacy to a higher level. Okay. So I'm going to scroll down here. And here's another thing I think is pretty important to note. Practitioners provide family with up-to-date, comprehensive, and unbiased information and informed choices. Okay. I'm going to go down here, and again, notice that they're bringing in the questionnaire. What types of questions are there? How it's being mapped out? What's being analyzed? The HLQ consists of 44 items within 9 scales. Okay, actually, I would nitpick in which ones I'd want to use, because 44 questions in a low literacy level, most people would not fill out. Okay. Going down here, I love how they put the validity is defined, how they define the validity. That's important. And they've used qualitative measures too, so they ask the quantitative to the qualitative. Okay. Now taking a look at this table is something I want you to kind of definitely look at. The earlier above it mentioned the 9 scales. These are the 9 scales. Feeling understood and supported by your healthcare provider. There's 4 items there. You could literally cherry pick, is what I'd like to call it, to go, okay, what health literacy questions based on these 9 scales do I want to know about? Is it having better ways to navigate the healthcare system? Is it actively managing my own health? Okay, I'm just throwing that out there. You can pick your scales. Okay, I'm going to go here, I'm going to scroll down and go down here to the settings and back down to the materials again, the Health Literacy Questionnaire. Okay, so This is a valid-driven approach. This has been studied and studied and studied for quite some time. So, what does it show? Psychometric properties, 1 to 5 score scales and option scales. They did much of a Likert scale, strongly disagree, disagree, agree, and so on. Again, the Likert type scales. Who their participants are, but more importantly, I want to kind of go through some of the ranges. I also want to go through a table that I think you might find quite interesting. Table 4 is the qualitative analysis, and it looks at the thematic responses from EI provider quotes. Okay, so how many? Look at the sub themes. Okay, word entitled. Okay, difference in U.S. and Australia. Answering based on provider perspective. Okay, take a look at this one. I mean differently. I'm definitely am much better at children and helping families at work find the right health care that they need for children. This is kind of interesting. What does that exactly mean? Okay, and then the other theme is only thinking of doctors, healthcare providers for support. Okay. Financial. Now we're bringing in financial literacy into this one, so I thought that was quite interesting. Okay, so there are the themes that I want you to kind of think about. What other themes would you think about if you were to try to replicate this study? And then, as usual, I'm going to go down to the discussion and look at it. Why this was important, and I want you to think about this one. Why? Because I want you to provide your own thought. This study is important because healthcare providers healthcare provider and understanding of health literacy can lead to better patient outcomes. I want you to think of some examples. Okay, and in order to translate this evidence, I love this right here. Health literacy strengths and weaknesses. What are strengths and weaknesses of health literacy within our own system? And finally, I'm going to go down here and look at, here it is. Okay, evidence for the consequences of testing is a long-term effort requiring pre and post data. There's other testing, optimizing health literacy and access, the Ophelia process. And then the National Literacy Demonstration Projects. There's other instruments out there. This is just one avenue in which to measure the literacy levels. Okay, and as we go through the semester, I'm going to be providing you with a lot more evidence of where to find those tools. Hope this helps. Keep up the learning.